Hi, I'm Jacob Kirsch. I'm a shoulder specialist at the Boston Sports and Shoulder Center. As a shoulder specialist, I take care of the entire breadth of shoulder pathology, both things ranging from rotator cuff tears, to fractures of the shoulder, dislocations of the shoulder, as well as advanced arthritic conditions of the shoulder. As a shoulder specialist, I also take care of both open as well as arthroscopic procedures. I have a particular interest in both revision and failed prior surgeries, as well as very complex procedures of the shoulder. One unique thing about my practice here at the Boston Sports and Shoulder Center is that I'm the only provider who takes care of conditions that can require both arthroscopic procedures as well as those requiring open procedures. Open procedures are things like fractures of the shoulder, shoulder replacements, as well as complex tendon transfers, which sometimes is necessary in the revision rotator cuff scenario. When it comes to taking care of workman's compensation patients, my philosophy is to utilize a multidisciplinary approach to work with not only the patient and their care team, but also their family members and their job to try and get them back to work in whatever capacity they are able, as soon as they are able. Now, often this requires working across teams to facilitate what's best for the patient, and no two patients are the same in that regard. Often we're able to get patients back to work and recover from their injury using non-operative treatment. And I always try to exhaust every form of non-operative treatment prior to considering surgery. When it comes to non-operative treatment, a core part of my philosophy is to utilize both traditional as well as non-traditional measures to get patients back to work and health. What I mean by this is obviously I will use things like physical therapy, occasional cortisone injections, other compounded medications, which are traditionally used to help patients out. However, I'll also utilize approaches such as acupuncture, massage therapy, aquatherapy, as a lot of these other approaches have been able to get patients back to work when traditional measures haven't. Ultimately, if non-operative approach fails to get patients where they need, surgery is always an option. Ultimately, my goal is to take care of patients' shoulder pain and dysfunction and get them back to being healthy and working. I always try and utilize non-operative approaches, and when surgery is necessary, I'm happy to do that for patients to try and benefit them in any way I can. When I think about surgery, it's a very individual decision to decide on whether to have a procedure or not, and this is something that we make not only with the patient, but their family and their care team. I know when it comes to choosing a provider, there are a lot of good options, but I certainly appreciate your consideration and look forward to working together to help provide the best possible care for your patients. Thank you very much.